it's a partnership, the two of
Right.
us are working together for a mutual goal. And, I always say there's 5 ways to treat pain, which was passed down to me from Dr. Friedman, one of my mentors. And now I always go through choices, and there's really more than 5 ways, but there's kind of like general categories. When you pick what works for your life and your situation, and only the patient can say that, they know their by them best, they know their life their best and what'll work for them. So I think it's a team, like you said, it's a partnership, and someone should give you options and be engaged. I think, in my opinion, that's what matters.
Hi, everyone, and welcome to Season 2, Episode 2 of The Breakdown with Rothman Orthopaedics. I'm your host, Alex Hammond, and one of the biggest concerns we hear from our patients is that our specialists will often resort to surgical options first and foremost to treat orthopedic issues. And here, that's simply not the case. So to help shed some light on non-operative treatment options and why patients and physicians should always consider non-surgical methods first, I'll speak with Rothman Orthopaedic specialist Dr. Faith Schick, who's a podiatrist, Dr. Saloni Sharma, physical medicine and rehabilitation specialist, and Dr. Michelle Mullins, non-operative sports medicine specialist. I'd like to welcome in Dr. Faith Schick, podiatrist who specializes in conservative treatment of foot and ankle conditions. Dr. Saloni Sharma, she's a physical medicine and rehabilitation specialist and is also the new medical director of the Orthopedic Integrative Health Center that just launched in October. And as well as Dr. Michelle Mullins, she is non-operative sports medicine specialist and one of our newest physicians to the Rothman, Florida family. So I want to thank you ladies all for joining me today. And as I mentioned kind of in our intro, our patients are just often, they're very concerned that anytime that they hear orthopedics, their first and only option when it comes to treating their issues is surgery. So I thought it would be awesome just to have the three of you just to kind of help debunk that. So we're going to hopefully answer some common questions patients may have, and we'll sprinkle in some questions that we asked our Instagram followers to submit. So let's get started. Usually I, again, just like everyone to kind of tell, briefly your story and how you ended up at Rothman. So, Dr. Schick, how about you go first?
I don't know if you really want to hear the story of how I ended up at Rothman.
We do.
It's interesting. So I've been here 10 years professionally, 13 years unofficially, because I did spend my residency time here. So every year when you're a resident, there's a conference that in New Jersey we all go to, and it's a really big social networking forum. So I happened to go to the conference, and then afterwards, usually your residency director or one of the doctors will take all the residents out for drinks and to have a good time. I happened to be out, went to a bar, was doing shots with all of my female colleagues and residents, and I met one of the doctors from Rothman who thought I was a riot. He was making fun of me and laughing at me at the time and said, "I can't believe this girl, who the heck is she?" And I asked him if I could rotate with him. And so a month later, I went on the computer. I couldn't believe I actually remembered his name and looked him up, showed up, professional, white coat on, everything like that. And I spent 3 years as a resident following the doctors at the Rothman Institute, only to end up working here after I finished residency. So you never know when you're out at a bar and having drinks and goofing off who you're going to meet, but that's how I ended up here. It was more of a social contact than anything else. So I don't know if anybody else has such an engaging story, but
no. I was just going to say, every time that I've asked that question, I'm pretty sure so far this is the best version of how did you end up at Rothman. So you definitely have gotten that prize. But great story. I love that. Yeah, no one's topping that.
But I will tell you, one of the fun things about my residency was I was in a program of 6 female residents, which I do think did help to mold and shape sort of the physician that I became. And I'll tell you, I'm actually really proud to be sitting here today on this panel because, being at Rothman, sometimes you look around and you do see a lot of men, but here we are today surrounded by all female physicians. And I think that speaks really highly to the Rothman Institute and my colleagues who are here, that I'm really proud to have people surrounding me like this. So I think this is great. I'm really excited to be here with both of you guys today.
Well, thrilled that you are here and agreed. And, the female physicians especially that we do have at Rothman, I mean, I always say a small but mighty group. So there's never, you go to one physician, one, and not to even say one's better than the other, but it really is like everyone is equally as great. So like I said, excited, similar to you, to be here talking to the three of you. Let's go, Dr. Mullins. How did you end up at Rothman?
Yeah, so tough to follow that, but
Yeah.
so for me, I'm one of the primary care sports medicine providers. So I did my primary training in family medicine, and then I did a additional 1-year fellowship in sports medicine. And mine was kind of also through word of mouth networking to some extent. I knew that I definitely wanted to get back to Central Florida. My family's all in this, Tampa, Orlando area, and coming home was important for me after kind of being out and about for training for a few years. And it was kind of through word of mouth, talking with some of my mentors in training and talking with other people that had come through the system. And some of them, actually one of them is up in Rothman, Philly right now. So kind of just getting a great understanding for the background of Rothman Orthopaedics, and then just the excitement surrounding this new expansion into Florida was definitely something that I wanted to be a part of. So yeah, very happy to be here. I was kind of fortunate, right timing in terms of this branch opening right as I was looking to get back to this area, and very excited to grow with the program moving forward.
Thank you for sharing. And obviously, yes, like you mentioned, newish to the practice and to the Central Florida, that team of physicians slowly growing. So happy that you're a part of that and kind of being one of the, in the, year one, still kind of falling into that. So glad you're here and thanks for sharing. Dr. Sharma?
Yeah, hi. So my story's kind of in between. It's not as exciting as Dr. Schick, but I also did residency in the area at Jefferson, and so we rotated through Rothman. And Dr. Mitch Friedman, who's one of the PM&R docs who's still here, was chief at the time and kind of was one of my mentors. And so I had a great experience and worked in private practice, and then came back to work at Rothman, and I've been here for more than 8 years. And I love our PM&R pain team, and that's my favorite thing about Rothman. It's the patients and the physicians I work with.
Great, and thank you all for sharing that. So I'm going to actually start right off the bat. One of the first questions that we received from our followers was, how did you get into medicine? But I kind of want to go into that a little bit deeper. But specifically, I'd like to talk about how did you get into your specific subspecialty? So I kind of just want to lay the groundwork for our conversation, if possible.
So I could definitely speak to that because it was a very personal experience for me. So when I first wanted to go into medicine, I thought I wanted to be a pediatrician. And so during college, I got a job working for pediatricians nights and weekends. And the position that I was in, I worked at the front desk. And so it would be me, a doctor, and a nurse in the office at the same time. And I quickly learned that pediatrics probably wasn't going to be for me, partly because of their on-call schedule and demanding new moms. But I remember one night I was there and there was a mom who had just had a baby, and the baby, well, actually she had twins. The babies were in the NICU for quite a while. And one night she shows up at the office and one of the babies was turning blue. And instead of calling 911, she decided to come into the office for care. And we immediately called 911 and started CPR. And unfortunately, the baby didn't make it. And for me, having that experience and seeing that opened my eyes very quickly to the fact that there's a lot of times in medicine where things don't go well. And you then, as a physician, have to be the person to explain that to patients or help them handle that grief. And I knew that I was very touched by that, and it stayed with me, and it still stays with me to this day because I do emotionally connect with my patients on a very different level. So I knew that I wanted to do something where hopefully I would be able to share more positive outcomes with my patients. And so my favorite part of my day is treating pediatric patients, and podiatry has actually given me the opportunity to do that, but in a different realm. So a lot of what we do is more sports medicine related. Kids have sports injuries, they twist their ankle, things of that nature, and I'm able to actually help them get better. And kids love to tell their story. So when they come into the office and they twisted their ankle in a game or someone kicked them with a cleat, they're so enthusiastic to tell their story, but also so enthusiastic to get better. So I'm really seeing the positive side of medicine for kids as opposed to, some of the other sides. And, even other things that we do in medicine sometimes are, just a little bit sadder. So I feel like what we do here at Rothman is very rewarding because we're helping people to get back to being their better selves. And so for me, I felt that foot and ankle really fit my personality in a way that I was able to treat patients that I was very enthusiastic about, but also to help them get better.
So I mean, just from my observation, it seems like you kind of joined both the, like, you've still, like you said, the pediatric patients, but then something that's a little bit less daunting where it's like, there's going to be a little bit of a positive result.
Mm-hmm.
Right. Exactly.
And, so I would say half of my practice right now is probably pediatrics. And then the other half is obviously dealing with other issues related to foot and ankle, whether it's, routine ankle fractures, arthritis, tendonitis, things of that nature. But again, a lot of it, getting people better. So, we're not looking at necessarily conditions where I'm saying, well, this is what you have and you have to live with it, but really helping people to kind of move on and continue on with their life in a more positive way.
Awesome. And we'll go a little bit deeper a little bit later about just, again, specifically your role as a non-operative foot and ankle. Has anyone else had kind of a similar experience as far as kind of getting into medicine? Maybe they were looking into other areas and then kind of, had that aha moment or had something where they were just like, nope, this is, either PM&R is the right one for me or sports medicine, this is for me. So kind of walk us through a little bit of your personal experience.
Yeah, so I knew, I think kind of senior year of high school that I was interested in potentially pursuing a career in medicine. I grew up my whole life wanting to be a teacher, actually, and I didn't quite understand. Yeah, I didn't quite understand at the time, but you can certainly be a teacher within the field of medicine, not just with your patients, but with other trainees, medical students, residents, and fellows. And so I think when I kind of made that connection, I had also had this interest in math and science growing up and had, again, some friends that were pre-med and kind of told me about that path. So it kind of melded all those things together that I was interested in. And then when I had experiences in medicine, volunteering at a hospital in high school, it just became clear that this was definitely the path forward that I was interested in. And, speaking to the type of specific patients that sports medicine interested me in was, this is a very motivated patient population. They're trying to get back to, sports or activities, whether it's, just walking their dog, keeping up with their grandkids from an arthritic standpoint, or, getting back on the football field for Friday night. There's a lot of extra motivation that goes into this type of patient population. And through my, family medicine training, I saw that I, always kind of had a special interest or, really enjoyed these interactions with the more orthopedic or sports medicine patient population and grew up playing sports. So could definitely relate with these folks. So that's definitely why I've trended this direction and excited to see where it takes me.
Great. Thank you for sharing. How about you, Dr. Sharma?
So for me, my mom's a physician. So I kind of grew up in the doctor lounges and Saturday mornings with her when she would go on rounds, and doctor lounges are kind of a thing of the past, but and then we go out for our special lunch just together. So it was kind of our special time.
Right.
So she's kind of, was a hero and role model for me personally and professionally. So I kind of had an inkling that I wanted to go into medicine. In regards to the field, PM&R, which is physical medicine rehabilitation, is really about restoring quality of life. So it's after an injury or something catastrophic happens, like a stroke or spinal cord injury, and you're trying to get better. And my subspecialization, my fellowship is in pain management. And so again, it goes back to quality of life. And so that's really my goal. Some parts of medicine focus on keeping people alive and other parts focus on, okay, now what do you do? And that's really what we're here to do, is help people live the best life possible and sort of enjoy the things they want to do.
Awesome. So again, you guys kind of, laid the groundwork of how you kind of fell into your specific subspecialties, but we speak this language every day, but there may be people that honestly, they don't know what is PM&R, what is non-op sports medicine, what is podiatry versus ankle surgeon. So would you all just be able to kind of explain a little bit? Let's do this. Explain a little bit about your subspecialty, and then maybe what's the contrast of your counterpart. So a spine surgeon, a foot and ankle surgeon, or a sports medicine surgeon, kind of what's the difference? Dr. Mullins, you want to go first?
Yeah, for sure. So primary care sports medicine, it's a pretty broad field that involves, any sort of non-operative orthopedic condition, typically more, acute sports-related injury, kind of classically, but we also see kind of chronic overuse, tendinopathies or tendon problems, and kind of wear and tear arthritis type conditions. So we see a little bit of everything. In terms of differences between, sports surgeons and myself, I can kind of get people all the way up to the door of surgery, but if they do ultimately need or want surgery, then, that's when they kind of take over. So certain conditions can be managed non-operatively, like an MCL tear is, you kind of brace and you rest and wait for it to scar down and heal on its own, versus other things like an ACL tear, which, depending on your activity goals, is often a surgical condition. So, we end up kind of seeing similar patients, but ultimately some of those, depending on their activity goals, their level of function, some of those end up becoming surgical conditions, and others can be managed from a conservative standpoint.
Makes sense. Dr. Schick, what are your thoughts?
So podiatry is a very interesting profession because it has progressed so much over the past, I would say, 20 years or so. All of the physicians at Rothman that are podiatrists are actually trained as surgeons. So from a standpoint of understanding the care that these patients need from start to finish, every single one of the physicians here knows the entire pathway of how to treat somebody conservatively, and then to anticipate what may happen if they ever do need to go on to having surgical treatment. We've structured our department in such a way, though, that we always want patients to start off with non-surgical care. So the podiatry department mostly does specialize in non-surgical treatment, although we do have several physicians who also do treat surgical patients at this point. That being said, we always want to offer patients the best in terms of non-surgical treatment and explore all of those pathways to keep them out of an operating room. So most of the time I will tell patients when I meet them the first time, my job is not to get you into an operating room. My job is to keep you away from the surgeon. And if I can do that, then I've been successful. So we always try to start off with that. But ultimately, sometimes there are conditions that I need to be very direct with the patient and say, well, we could try these things, but sometimes you are better served having something fixed. So it is having the ability to also differentiate the patients that need the conservative treatment, and you're going to be able to do something good for them, versus the ones that need the surgical care, and that's going to improve their quality of life faster.
Can you talk a little bit, just before I go to Dr. Sharma, like what are some of the conservative treatments that you will consider with a patient?
So depending if it's a biomechanical issue, I will tell you there is nobody in the field of foot and ankle medicine that understands the biomechanics of how the foot moves better than a podiatrist. You always want to have patients take off their socks and shoes when they come in the room, and expect that you're going to take off both socks and shoes, even if you're just coming in for pain on one foot, because we want to see you stand up and we want to see your balance and your alignment. A lot of times with some of the other physicians, they will see a malalignment, whether it's something where patients are having knee pain or they're having pain in their back. So a lot of the patients that I see are referred from other specialties within Rothman, because we always say the foot is the foundation of where the alignment of the rest of the body comes from. So that's always really important, that we straighten that out first. We give patients a good sense of balance and alignment. And then from there, if we need to incorporate other measures such as physical therapy, or if it's a sports injury, sometimes bracing of some type, we'll incorporate those things afterwards. But we definitely want to look at how patients walk and how they stand and evaluate that to really see how people function.
Dr. Sharma, I'm going to get into a little bit more, but Dr. Mullins and Dr. Sharma, do you find like kind of similar sort of conservative treatment, like obviously physical therapy, orthotics, is that kind of across the board, we'd say, that in the non-op area? Or is there anything else that you would consider as well?
So some of the typical conservative stuff that people will try would be, just basic ice, rest, kind of activity modification. So if you just started a new running program and now your knee hurts, maybe backing off for a little bit and see if things start to settle down on their own. So those things are kind of the most basic even before they get to the office often. Sometimes people will buy braces or things over the counter to try on their own. There are different specialized braces and things that we can use in the office once we kind of diagnose a specific area. And then from there, physical therapy, I feel like we could all use a good physical therapist in our lives.
Seriously.
Yeah, pretty much everything I think can
Yes.
benefit from physical therapy. There's always something to find there. And so oftentimes my patients will see a physical therapist, and then as you guys had mentioned, sometimes referring even within the group to if there are other areas of expertise, can be helpful, whether that's, occupational therapy or, having them fitted for a specific brace in the office or seeing another provider. Those can be all kind of typical conservative things that we try before kind of advancing into more interventional options.
Yeah, it's similar things. It starts really with lifestyle changes, especially for spine pain. We primarily treat spine pain, P&R department at Rothman. And so you really want to think about a healthy diet, a healthy weight, proper nutrition, even an anti-inflammatory diet is important. Sort of considering that whole lifestyle picture, tobacco cessation, and then you kind of get to physical therapy. We talk about medications, especially non-opioid medications that can be helpful. And then the P&R group also does interventional spine procedures, like some of the other groups do different procedures as well, including epidural steroid injections, spinal cord stimulators, and sort of more advanced procedures before we get to surgery.
Dr. Sharma, I have two questions for you. Do you find because again, you essentially would be considered like non-op spine, do you feel that patients come to you and they're already scared because something with my spine or my hip or anything and potentially being, operated on? Like, do you feel like you deal with that a lot? I feel like you'd probably have that more so than the other ones because it's, spine surgery, just, people freak out. So what are your thoughts or your experiences?
Yeah, for sure. I mean, and a lot of people seem to feel like it's either therapy or surgery. They kind of miss like the in-between. And
the in-between, right.
Yeah, there's a spectrum. There's lots of choices. So it's not either you're, going to have an injury your whole life or you're going to have surgery. There's a big room in there and there's lots of options. And that's really what we can offer. I'm also an acupuncturist. And so, I offer that through Rothman. And then, of course, we have our new integrative medicine center as well.
That was my next question because you were talking a little bit about nutrition and tobacco cessation and acupuncture. So speak a little bit about kind of starting this program and, this is kind of the best way it's kind of used in combination with some of the other orthopedic subspecialties. So kind of just talk about that a little bit.
Yeah, so it's really just to enhance orthopedic care. So it's not to replace care, but, if you're seeing myself or any of the other physicians at Rothman and you sort of want an integrative approach, it takes conventional orthopedic care, musculoskeletal care, and then we add lifestyle medicine and pieces of integrative medicine, and it comes under this umbrella we call integrative health. So it's again about quality of life, but you're with us, you're with a physician for 15, 20 minutes, maybe you're with a therapist, maybe 2 or 3 times a week, but it's what are you doing those other 23 hours a day? And it's really getting into that and how lifestyle factors such as nutrition, even stress resiliency, sleep can affect your injury and your recovery, especially if you end up becoming a surgical patient. Preoperatively and postoperatively, it matters, what your stress is. It matters what your nutrition is going into surgery and recovering. And so that's part of it. Part of it is if you have a back injury and let's say you're not a candidate for surgery, or let's say you're not a candidate for an injection, or perhaps that's just not something you want to do. You don't want to pursue injections. And in this day and age with opioid crisis, you want to avoid a lot of pills. This is a new path that sort of focuses on evidence-based ways to help pain and help get you going.
Great. I want to just back up a little bit because I think everyone kind of mentioned injections. So, and this was actually a question that we received from one of our social media followers, and they wanted a little bit more information about injections and how do they work for orthopedic issues? So I guess does surgical and non-surgical, does everyone use injections? But specifically just talk about, who do I go to if I want for one and who's considered for it?
So I'll start off and say I almost never inject. I may give an injection once to twice a week, and usually not for the purposes of anything palliative, but I can say I gave an injection today because someone had an ingrown toenail that I had to remove. And so we wanted to do that as painlessly as possible. But for the most part, I would say we really try to practice an approach that isn't throwing a lot of medication at patients. Sometimes we'll write anti-inflammatories. I have not written for an opioid in nearly 10 years.
Wow.
Not something that's a part of my practice. Patients, if we really set them up in the right position from a standpoint of rest, ice, elevation, non-weight bearing, immobilization, whatever we need to do to treat them, patients actually really can do well with most foot and ankle conditions with Tylenol as a maximum medication that they need. But then again, with foot and ankle, injection therapy sometimes can be limited because, again, you have very small joints that when they become arthritic can be very difficult to get into. And even if you are able to, you have to imagine the stress and the weight of the body that is putting force on that. So a lot of times we try different approaches in terms of shoe modification, sometimes topical treatments and things like that we'll use to try to offer patients pain relief instead of putting substances in the body that way. So a little different, I think, for foot and ankle than a lot of orthopedics, but I do find that patients come in sometimes very concerned because they think that they're going to get an injection.
Okay.
And they're very relieved when they leave the office finding out that they're not getting one. So from a foot and ankle standpoint, if you are nervous, don't be afraid. You can come and see me and you will not get a needle.
Nice little plug. Well, Dr. Sharma, go back to you, because you typically, is it safe to say you're probably the opposite of the foot and ankle group because you typically have date, right? Am I making that up?
It is. It's funny. It is opposite because my patients come in begging for injections. That's what they want. And they're actually upset if they don't get injections. And a lot of them are relieved that injections are an option as opposed to going straight to surgery, unless
Right.
it's of course necessary. So yeah, I mean, I do a fair amount of injections and like Dr. Schick said, it's just different, the foot versus the spine, and that can help a lot of people function better. So.
Right.
I always tell my patients that the smaller the joint, the more it's probably going to hurt. So I know they're always very weary of foot and ankle injections as well in my practice, and I'm kind of a mix. I'm like between you two probably. So we do a fair amount of hip and knee injections in terms of patients that are hoping to avoid or delay joint replacement surgery. That's a big part of my practice. But then otherwise, I think in other areas, we've trended away from injections for some things. So we know that, long term, that's not great to put a lot of steroid or, directly around a tendon. So for certain conditions, you have patients that come in asking for injections when maybe 10 years ago, that was something that was done more commonly, and we really backed off on that. So some of it's about kind of managing patient expectations and trying to kind of walk them through the current evidence on what the best approach is. But I never force injections on anyone. No one really comes in excited about the idea of an
Right.
injection. But, sometimes if we're kind of failing other options, that is something that we have in our pocket to try.
How do you know, like, who's the best non-op specialist for me? What would you say is, like, the best way to, like, approach it? Or how do I know someone's right for me? I mean, I guess anytime you see a physician, like, you can kind of check. But is there anything that patients should be looking for when they're choosing a non-op physician or a physician in general? Like, stay away from someone who's like, yeah, we're going to take you to the operating room. We didn't even need to look at you. Like, I'm being obviously silly, but yeah, is there anything you would go into when telling a patient to look for in that area?
I think I can start with that one. I think there's a couple things. I mean, one is, do they listen? Do they listen to what you're saying? And are they making eye contact? Are they engaged with you? Are they repeating back what your concerns are? I think that's important for any physician-patient relationship. I think also, are they giving you options? Sort of like you said, Alex, or are they just, this is the one option, you have to do this, And so,
like a team approach, like with your patient, right? Like, yeah.
It's a partnership, the two
Right.
of us are working together for a mutual goal. And, I always say there's 5 ways to treat pain, which was passed down to me from Dr. Friedman, one of my mentors. And now I always go through choices, and there's really more than 5 ways, but there's kind of like general categories. When you pick what works for your life and your situation, and only the patient can say that, they know they're by them best, they know their life their best and what'll work for them. So I think it's a team, like you said, it's a partnership, and someone should give you options and be engaged. I think, in my opinion, that's what matters.
Would you all kind of agree, or is there anything else you can add to that?
Yeah, I think making sure you find a provider that can understand basically what your goals are and what context this injury or this condition has in the setting of your life, because not everyone is necessarily treated the same way, based on what impact the condition has on them and where they're trying to go with things. So making sure that you're able to get on a clear understanding of that with your provider. And I always look my providers up, just kind of read their bio, see what are their special interests, and if that pertains to potentially what I'm seeing them about, but just to understand them as a person as well, because it is, like you're saying, that team approach, and you want to make sure that you're on the same page with things as you make these decisions.
The internet is a beautiful, beautiful thing for that reason.
No, I agree wholeheartedly with both of you guys regarding that. I think that Every doctor at Rothman Institute is incredibly well trained. Everybody is board certified. So, I don't think you can go wrong with any physician if you go through our entire list. That being said, I always tell my patients, especially whether it's non-surgical or surgical, you need to like your doctor. You need to have a conversation with them. And you need to feel comfortable with them. So
Yes.
I could send my patients to any of my colleagues, and at the end of the day, I always try to say they're all going to be really good. You just have to find somebody that you feel comfortable with and that you like, and that's what's really going to lead to the best outcome because they're going to be able to communicate better.
I actually want to ask that question because, again, that's one of the things that we, rightfully so, we brag about at Rothman is just like you can literally go down the hall and then we have the next, physician who's equally as great. That's the whole thing of us being subspecialized. So how often do you kind of collaborate with your colleagues in other subspecialties or, again, being the three of you all in non-op in your specific subspecialties, working together across the line. So speak a little bit about that.
Yeah, I feel really fortunate to be at Rothman, where you have expert joint replacement surgeons, expert sports surgeons, all sorts of specialists just down the hall from you. And it happens, I would say daily, where either I'm bouncing a patient off of one of them or they're coming over and asking, what non-operative options I would have for a patient that they're trying to avoid surgery for, or trying to really make sure that they're exploring all the other options. So, it definitely goes both ways for me as a non-operative provider. And I think that is, a huge benefit to being within the Rothman system is that any, obscure case or even just something that is straightforward but is not responding as anticipated, we always, we can collaborate and come together to offer you the best options.
Yeah.
Agreed. I think our resources at Rothman are absolutely endless. I mean, how many offices can you go into where you can be x-rayed the same day, get a brace the same day, and then even be referred for physical therapy and have your physician be able to speak to and integrate with every single one of those people that touch you. So, if I have something that I want, to fit somebody a certain way, I can go over and talk to the ped orthopedist that's bracing that person and say, add some extra cushioning here, add some extra padding there, and then go over and tell the physical therapist, I'm concerned that they might not be able to handle crutches. Can we try a couple different things and see what's going to work best for that person? So it's not always even just the physicians, it's all of the resources that we have that I know that when my patient leaves the office, that they are in the safest position possible to heal whatever condition it is that they're trying to treat.
Yeah, definitely.
Yeah, I agree with all that. I mean, and like Dr. Mullins was saying, I probably talk with the spine surgeons at least weekly and go over MRI films of my patient to bounce off whether it makes sense for them to even see the surgeon. And likewise, they often say, do you think this injection will be best? And it's a great team approach. It's really like you see one of us and you get the benefit of multiple specialists all at once.
Yes. All 180 of our physicians, right? I have one, well, it's like the second to last question before we wrap up, but what would you say? I know, Dr. Schick, you kind of said, what the favorite part of your day was, but for Dr. Mullins and Dr. Sharma, what's kind of the best part of your day?
Well, right now for me, it's seeing an integrative medicine patient.
There you go.
Open that center and I'm super excited about it. And then again, integrative health. But because it's a 45-minute visit and I just get to sit down one-on-one with a patient and I really get to know them. It kind of echoes my acupuncture appointments where I spend a lot of time one-on-one with them. And I know about their families. I know about their trips. I know, a lot of stuff. And with the integrative center, really those things impact their health. If someone has the stressor of having to worry about a sick husband or has a grandchild who they have to care for, and that affects their back pain, we factor in the ergonomics of that and how she can take care of a grandchild. If someone else has an issue at work and the ergonomic setup of their computer is aggravating their neck pain, we can talk about that. We can talk about mindfulness. We can talk about an anti-inflammatory diet. We can talk about sleep and how to sort of do like a sleep hygiene routine. So that's my favorite part right now is when I have these integrative patients and I really get to sit down and really get to know the patient as a person. And I don't even like that word patient, it's just like two people sitting down, talking together like a team and, learning a plan to feel better.
Great. Dr. Mullins, what about you, especially your quote unquote newbie here as far as joining Rothman? So what's in the past couple of months, what's been the best part?
Yeah, I think for me currently, we're still in football season, so Friday nights are favorite part of my day currently. We work with some of the local high schools here, and so all of the operative and non-operative sports medicine providers down in Rothman, Florida, are affiliated with local high schools, and so we're on the sidelines, kind of working with acute athletic injuries as they happen. And so for me, a large part of what drove me into family medicine was being able to see athletes kind of where they are, see the injuries as they happen, and understand, that whole aspect of things. And then it's also fun just getting to you check up with the other athletes that you've seen previously in clinic, kind of follow up on things. Watch football is never bad. So for me, I definitely enjoy kind of being out with sideline coverage, and that's a huge part of my, highlight of my week, I would say.
Not a terrible way to spend a Friday night, right?
Yeah.
Dr. Schick, you have anything else to add about your favorite part of your day?
No, I really will say, I enjoy watching my patients grow. And I think that's one of the coolest things now that I've had some time here at Rothman Institute, is that I've seen patients that started off at 10 years old, and I was making them their first pair of orthotics and helping them get through soccer practice to now they're getting ready to leave for, police academy or military boot camp. And, I'm watching them grow up and, move on with their life, and they're still my patients. So, that's one of the coolest things is if you have a patient as a child, their feet grow. So, you need to keep helping them as their feet grow up, but you actually watch the human beings that they become. And, sometimes as you build that relationship, they start to ask you questions and you build that trust. And so you become more of a friend than just a physician. And being that role model for my patients is really rewarding as well.
Great. All right. So this is the last question. This was a question submission. It's a real serious one, but someone wanted to know, do any of you have pets? And if so, do you exercise with any of them? This was an actual, and I was like, we absolutely have to ask this. So does anyone have pets?
Yes.
Dr. Schick, I was like, I know you have pets.
I do.
Do you exercise with your pets?
I do.
Okay.
Not that it's the most robust exercise because they are small. I have 2 dogs. I have a Westie named Delilah, and I have a mini Schnauzer named Griswold. We are big National Lampoon's fans in our house. But I do. I will walk with Delilah through my neighborhood. Especially this year and last year through COVID, it's been a really great outlet for mental health and relaxation, but also just to get some exercise, and she enjoys it so much. And then in the summertime, the 2 of them love the pool. So we're out there swimming all the time, all weekend long. You'll find us outside, and that's just another nice form of exercise with them.
Love that. Anyone else? No other?
Yeah, I do. I have a Rhodesian Ridgeback. He's a 95-pound puppy, and so he has a lot of energy. I like taking him out on walks as well. I guess I want to get him to be able to run at some point with me, but you have to wait until they're like 2 years old, apparently, for orthopedic reasons.
Yes.
Can't run with him too early. So,
yes.
But yeah, I definitely enjoy hanging out and unwinding with my dog.
Yeah, I have a 75-pound German Shepherd, and one of the things when I first got her, I rescued her when she was 3. So I had to, she had to get cleared for running and all that before, checking out all of their joints. So yes, I too like to exercise with my dog. We can't do it too early in the morning or too midday. Too many squirrels and the attention span. So it's kind of what we're dealing with. But she can run. We do some distances, but yeah, the squirrel thing is could be a little difficult.
I kind of have a 2-part answer. I have 2 children, so I exercise with them.
Okay.
Yeah, I often walk them. But it's been very therapeutic in the pandemic, taking them outside.
Yes.
But so because of that, we have not graduated pets because they're kind of young and they're a handful right now. We do have Sebastian the hermit crab, and I do not exercise with him, but I do have that pet.
Listen, mine's up for rent anytime you want to practice. So standing offer. But, before we go and kind of wrap up here, I do want to give you all, just again, thank you, all 3 of you, for joining me today. But just want to give you guys the opportunity. I always like to give everyone an opportunity, kind of like your elevator pitch or any last words before we get out of here. What would you say to a potential patient or anyone?
Back and neck pain, unfortunately, is very common, but there's lots of options, and we're all here to help you in a team approach, from the therapists to the orthotics to physicians to the mid-level providers, and kind of all across the board, including the surgeon. So we're here for you, and it's a team approach, and we're going to hit it from a couple different angles, and we're going to help you feel better.
Love that. Who's next?
I think we've all suffered from foot pain at one point in time in our life. And sometimes we just think it's going to go away, or we think that we just have to learn to live with it or deal with it. And a lot of times that's not necessarily the answer. Seeing a foot doctor sometimes is a very personal experience because people are afraid to come in and address these issues and take off their socks and shoes. But really, it's not. We all have 2 feet, and you're not alone. So if you do have any anxiety about it, come in. We try to make you as comfortable as possible and hope that you'll have a good experience with us.
Great. Thank you for that. Last but not least.
Yeah, so I would say whether you're kind of an elite athlete, like a weekend warrior, or just trying to stay active and keep up with your grandkids, primary care sports medicine providers can offer a wide range of non-operative treatment options with a goal of improving your pain and function. And if ultimately we do progress towards a surgical indication, we have a wealth of providers and knowledge here at Rothman to get you in the right hands. So, yeah.
That was great. So again, I want to thank, Dr. Mullins, Dr. Sharma, Dr. Schick, all 3 of you. And like you said, kind of echoing what you said in the beginning, Dr. Schick, with having like 3 women doing kind of this panel, this podcast. Love that energy. And it's great. We're, lucky here at Rothman to have all 3 of you here. So again, just want to thank you again for your time.
Thanks so much for having us.
Yeah, thank you. That was great.
Thank you.
We'd like to thank Dr. Sharma, Dr. Schick, and Dr. Mullins for joining me on this episode. Please visit our landing page, rothmanortho.com/podcast for all available episodes. We're on Spotify, Apple, Google, and a few other listening platforms. And as well, don't forget to check out our special visual episode that's available on our YouTube channel. Make sure you subscribe, like, and share on whatever platform you utilize. Thanks again for listening, and until next time, take care.